the bull by the horns. Food addiction is something I personally have seen in my own practice in coaching people on and off for 30 years. And I didn't really know it. I know when I was in school, it was not even, it was considered, didn't exist. And there still are critics out there who'll say, oh no, that's, some crazy idea from the people in California, and it's not 100% recognized yet. So how would you respond to that criticism?
Well, it's food addiction is a very different thing than every other addiction because we can't quit food, right? Every other addiction is something that we can quit, something that we can dramatically alter our relationship with, but we need to eat. We need to eat regularly. We need to eat every day. And so it's something that you can't quit. And I think that it's something that's gaining awareness more and more in the field, but it's not yet something that's accepted as a true addiction in the way alcohol addiction or drug addiction or any of those other things would be. However, a lot of the ways it manifests are the same. I mean, when you look at diagnostic criteria for alcoholism, I mean, we're looking at differentiating between alcohol abuse and alcohol dependence, and both of those have diagnostic categories.
Yes.
And you see how one can kind of lead to the other, and you see that very, very often in the way people use food for reasons other than feeding their body, when they use food emotionally, when they use food as escape, when they use food as reward, when they use food as anxiety relief, almost the way they might use medication or something else. So you see it kind of move from abuse to dependence in a lot of the same ways you see with drugs and alcohol. So there's a very clear correlation between the two, yet I think that the concept of food addiction as a diagnosis is probably coming, but it's not, fully accepted yet. So I think we're on the path to making that a real accepted thing.
Absolutely. I know a few years ago, my wife and I were with some friends over in Italy, and we were down in Pompeii and checking out the place with a guide, and he pointed out one of the old villas. We were in the ruins of it and said, oh yeah, this is probably where the fomatorium was. And so, that was a real thing there. It wasn't like, the gorging and, obsessive. That was a very, very common thing. Apparently wasn't much any shame about it. It was just,
well, yeah, that's what I was going to say. It wasn't viewed negatively. The idea of, either let me make myself throw up so that I can eat more, or let me eat as much as I can because I know I can do this after to make myself feel better.
Yeah.
And, it was almost socially accepted, right? And now it's part of criteria for several eating disorders, right?
Right.
The idea of engaging in these compensatory behaviors so that you can overeat and you can, stuff yourself, feel in control or escape or whatever it is that people are doing. It's this compensatory behavior to deal with either the guilt or the associated weight gain or any of these other feelings that are associated with this behavior that's deemed negative.
Right. Amazing. Well, that brings to mind another question, and this is part of the shame that a lot of people would feel. Is I've had customers who would come to me and they'd say, listen, I'm so disciplined in my work. I've been exercising, for all my life, and yet now I can't stop eating at night. Or maybe it's I can't stop eating after my kids and spouse go to bed, and they don't even know about it, but I'm gaining all this weight and I'm still going to the gym at 6 a.m. every day. Have you dealt with anyone in that kind of case?
Yes. I mean, I hear something very similar a lot. And what I hear is, I got it down in every area of my life. I can be in control. I can be on top. I can succeed. And I just can't do it here. I just can't do it with weight or dieting or my relationship with food. And part of that definitely goes back to the fact that, again, we need food. Food has been a part of our daily life as long as we've been in existence. So it's not something that we can put the same limits on like we can with the gym. It's also not a choice to eat or not eat. We have to eat. And so it completely changes the relationship that we have with food. And most of us develop these unhealthy issues around food at a very young age, right? They're issues that are developed through the way our parents presented food to us, the forcing us to clear our plate idea, or, a lot of people grew up with they're starving children somewhere, so you have to eat.
Oh, yes.
Right? All of these things that completely disconnect us from what's going on with us physically, understanding hunger and satiety, and just looking at something external to govern how we eat and how much we eat. We all also often grew up with the idea of food as reward.
Yes.
Right? The idea that when we do well, we're treated to sugar, right? Or, that if we clean our plate, we even get more food, food, high fat food as a result of doing that. So all of that sets us up for this incredibly unhealthy relationship with food, where food is not about, sustaining our body. Food is about all of these external things. And when you look at that, right, most people don't have that kind of relationship with the gym or with their work or things like that, because they weren't manifested at such an early age. So it's a much harder thing for people to change.
So if we could maybe have, say, a hypothetical patient comes to you and they're dealing with that exact thing. They've got their life together on pretty much all areas except for, controlling the food and weight and that sort of thing. What would be step one? Or could you maybe walk us through, a hypothetical case study?
Sure. I mean, step one is to just see what's happening, right? And I usually have people just start tracking their eating, not in a calories and macronutrients way, but just when are they eating, what are they eating, and why? And it's really kind of the why factor that's critical, right?
Okay, that makes sense.
Because I have people come back to me and 70% of what they're tracking, why they're eating, is because I'm hungry, and that's fine. It's the 30% that's not, that is what calls my attention. I'm eating because I'm bored. I'm eating because there was just food in hand's reach. I'm eating because, everybody went to bed and I was able to eat in secret. I'm eating because I had been on a diet for 2 weeks and hadn't allowed myself to have any sugar. And then I was around sugar and I wanted to just eat all the sugar, right? All of these other reasons that come up that cause people to eat. And, once I have sort of awareness with whoever I'm working with of, what are these other reasons that are causing them to eat? And also, when is this happening? Because sometimes you can find patterns. It's always happening at, 11 o'clock at night when everyone's asleep, or it's always happening between 5 and 7 p.m. when I get home from work, but before I've had dinner, and not realizing that I haven't eaten in 5 hours and I'm actually really hungry, but I'm waiting till dinner. And in the meantime, I'm doing all of these things to save myself, to get through that period of time. So, really kind of understanding when this is an issue and what are the emotional parts of it that are triggering that behavior. And then using that, I can kind of dig in personally to what's going on with that person, because it's not a one size fits all thing, right? Everybody has their own triggers. Everyone has their own history. Everyone has their own emotional relationship with food. And so I feel like you need to address that where that person is, as opposed to just addressing it globally.
Right. Absolutely. So, and could we talk briefly about, not to go too into the weeds, but if we talk about the brain itself, I mean, and this may be a bit theoretical, but there's the idea of the reptile brain, and then there's the prefrontal cortex, if I can get that out. Sorry, I've been awake too long today. And so the reptile brain is going to, maybe some would say, perhaps, could you say we override some of the, the discipline factors that maybe the prefrontal cortex would that be a way of, would that be accurate to say that, or am I butchering that analogy?
It's not inaccurate, but I tend to look at it a little bit differently, in terms of, well, for starters, from a real Freudian standpoint, you're kind of talking about, the id overriding the ego and the superego, right? I want my immediate needs met as opposed to looking at my long-term needs. Right. And then there's this whole overarching view of self-sabotage and how that kind of plays into, I know better, I know what to do, but I'm not doing it. And what tends to happen is people are very focused when they're in an emotional state, when they're experiencing anxiety or stress or something like that, their brain and their hormones and their neurotransmitters, I mean, cortisol in particularly kicks in and has them solely able to focus on the present. I want something that's going to make me feel good for the next 5 minutes. I don't care about the next 5 hours. I don't care about the next 5 days. And so what I want is high fat, high sugar, right? Something that's just going to calm that part, maybe give me a little bit of a dopamine release and make me feel a little better. And I'm not connecting the dots with how am I going to feel in an hour and how am I going to feel tomorrow? And so a lot of what I do with people is help them connect those dots, help them start asking those questions in the moment, because almost always whatever they're eating to feel better in the moment is momentary. It may last 5, 10, even 20 minutes. But afterwards, all of those negative emotions they were experiencing that caused them to eat are still there. And now they have a few others, oftentimes guilt, oftentimes shame, oftentimes this whole layer of self-attack and this perception of poor self-efficacy and, just lack of belief in their own abilities to control themselves. So now, bless you, we have all of these negative emotions that started it, and now we've tacked on a whole bunch of others. And then maybe we go even further, and the next morning they step on the scale and they're not happy with what they see on the scale. So now we have even more. And the problem is, in the moment, we're thinking, I'm stressed, I want food, and there's this direct connection. These synapses are connecting right there with nothing in between. And we need to put all this other stuff in between so we can start to say, wait a minute, this isn't going to make me feel better. And I'm going to feel worse for all these other reasons, and that's not what I want. So what else can I do?
Right. And so when you get to that point, okay, you've identified the problem areas, you've identified maybe some of the emotional, architecture going on under the hood. What is there any, cognitive tools that you would work on? I mean, I'm sure you have plenty of things. Do you have some go-to, recipes?
For sure. In the world of cognitive behavioral therapy, one of the hallmarks is the identification of cognitive distortions, which is basically, ways that we distort reality to fit into like our existing thought schemas. And there are like 13 of these, I believe, but everybody has like a few that are their go-tos. And I can give you some examples that most people can relate to. A really common one is all or nothing thinking or black and white thinking. The idea of seeing things, in these terms of either all in or all out. And you see this very commonly in people's relationship with food, right? I'm either on a diet where I'm eating chicken and broccoli for every meal, or I'm off a diet where I'm eating everything under the sun and I don't care about anything whatsoever and there's no vegetables in sight. Right?
Yeah, nothing in between.
This black and white thinking. And the extreme nature of it is what causes the back and forth, right? The strictly chicken and broccoli is what caused that restriction effect, is what causes somebody to swing to the other side and do all that. So, in an example like that, the idea of identifying all or nothing thinking helps you work on establishing, gray thinking, embracing things like an 80-20 mentality, or, understanding where their behavior is extreme and how they can let up on that just a little bit to allow for a little more fluidity, a little more moderation to break the yo-yo impacts, right? The idea of moving to the other extreme. So, another example that comes up quite frequently of a cognitive distortion is called dwelling on the negative, which is, the idea. Sorry?
The other example was?
Dwelling on the negative.
Dwelling on the negative. Okay.
Yeah.
Okay.
Yeah. So I use this example a lot with people because most people can relate to this. We can go through our day and do 100 things, let's say, and we do 99 of them right and 1 of them wrong. Wow. And at the end of the day, the only thing we're focused on is that one thing we did wrong. Right? The reality is we should be patting ourselves on the back like lunatics, saying, I'm amazing. I did 99% of things right. How awesome am I? I'm like a superhero. But instead, we're sitting there going, I can't believe I screwed that up. I'm such an idiot. I'm always making mistakes, and, dwelling on the negative, because we are basically ignoring all of that positive and putting all of our energy into that negative. And that doesn't help us. It's not motivating, right? Beating ourselves up doesn't give us all of this empowerment to move forward and make things good in our lives. It sets us up to repeat that behavior. And so when you can identify that as a behavioral issue and start looking at how do we find the positives? How do we force that, right? Let's look at our day and now identify the 99 things we did do right, and putting emphasis on that, putting energy on that, putting focus on that positivity. Even if it's just about starting your day with a positive thought, or going throughout the day and saying, what can I pat myself on the back for today? It's not about saying I didn't do anything wrong, but it's about saying, let's put attention on the positives to change the impact of these thinking errors. So those are some examples of cognitive distortions and how you can use things like that to change these behavioral loops.
Right. Oh, that's fascinating. And what about the, as you mentioned earlier, a lot of times we get these programmed ideas, as children, and the idea of we need to please our parents, or we need to, and so I know here in Spain, and I've got a lot of friends in Italy, if you go to somebody's house and you don't eat at least a little bit of everything that they, Mama's going to be upset. She can, she may not say anything, but you once you get into the family structure, okay, then you just start to hear it. But if you're just coming in as an outside visitor, maybe they give you a free pass, So so I can notice that going on.
It's not just in Italy. I call it like the mother-in-law syndrome.
The mother-in-law syndrome,
yeah. And it's the idea of like food is love, right?
Yeah.
I've cooked for you. This is how I'm showing you my love. You accept my love by eating it.
Right.
And in and of itself, it's okay. It's just about, portioning, awareness, planning. It's when it feels like doing that is wrong, or again, looking at that all or nothing thinking that it's going into the nothing category. And if you eat that person's food, now you've completely gone 180 degrees off your diet, so you might as well just stay there and continue to eat everything, right? It's the mentality that goes along with it. So how can you allow that in moderation, in a way that feels controlled, in a way that makes you feel like, gives you that perception of control, which is the most valuable thing in the world. The control piece is irrelevant. Our perception of control is what really matters, because if we believe that we are in control, that belief is what carries us forward.
Yeah, absolutely. I think something that I've found some success with myself, as well as with some of my coaching clients, is actually just being really, really honest. Not, if it's going to be a reoccurring situation, talking to the person away from the meal and just saying, hey, listen, I really appreciate you cooking, this, what you're making, and blah, blah, blah. It's so wonderful. I love that. But, I've got this situation and I can't eat that, even though I'd like to, like in my case, I've actually realized I was pre-diabetic about 10 years ago. And I used to be eating this super high carbs and doing all, I was even doing some triathlons, you think you're burning off all the carbs, but actually you're still got to process all of that. And I didn't realize that wasn't working for me. So I've got to be really careful with the carbs. And so I've been able to explain to my mother-in-law, gosh, I would love to eat your tortilla española, which is like the frittata in Italy. And so now what I'll do, I'll just have a small piece. I'm just like, I'd love to eat the whole thing. I probably would have.
Yeah. And it's a good example, right? I mean, somebody who has, an actual health reason, whether it be diabetic or pre-diabetic or a gluten intolerance or lactose intolerance. I mean, those are easier things to say, I physically can't. But, the idea that you hit on that's really valuable is, have a little, show massive appreciation, and then, have a simple way to address it. I'm so full, or I already ate, or, I will definitely eat it later. I love it. It's incredible. Thank you so much. I'll take some home. I'll have it all day. Right. It's not about needing to eat it all right there in front of them, but about showing them the awareness and the appreciation of, the gift of love that they're giving you, and accepting that love.
Yeah, that's great. Yeah, that's another one. And she'll prepare enough for 4 meals, and And so I said, that's exactly what we started doing. We'll say, gosh, that's so awesome. You've done that. Thank you so much. And we'll take it. We'll have food for the next 3 days. So,
yeah, that's perfect.
We're happy. We just dose. It's like, dosification.
Yeah. Yes. Volume control.
Yeah, absolutely. Absolutely. Well, gosh, there's so many different ways different things to talk about here. Have you, I'm just curious, have you heard of Dr. Glenn Livingston? He has a book called I think it's called Never Binge Again.
Oh, interesting. I haven't. I know a lot of the binge eating authors, but I'm not familiar with them.
I just downloaded his book, so anyway, it's an interesting book. Well, let's shift gears here a little bit, if we could. What would you when you're working with someone with eating problems, who oftentimes has a weight problem, who's not doing exercise? How do you normally start a non-exerciser on an exercise program?
I usually start them
one at a time.
Yeah, well, a non-exerciser to get exercising, one of two things. Either I have them commit to do something 5 minutes a day, like, follow a YouTube video for 5 minutes, or, do jumping jacks and sit-ups for 5 minutes, or something along those lines. Or I have them identify something physical that they either have enjoyed in the past or that they think they would enjoy, something that feels fun. Right? For a lot of people, going running doesn't feel fun, or, going to the gym and lifting weights doesn't feel fun, but going for a bike ride does, or, doing, an aerobics video does, or playing tennis does. So helping them find the thing that they think they would enjoy. And then again, I have them, because I see people like weekly or biweekly, having them commit to do that thing just once in between our session and our next session, so that they can try it out, but that it doesn't feel like a massive task, right? It doesn't feel like they're setting themselves up for failure. So using an example like that, somebody who maybe they really like bike riding, and I give them a homework assignment to do a bike ride between now and our next session. Almost always they will come back having done more than one bike ride, because their homework assignment was just to do one, which was an easy task for them. It didn't have a time limit. It wasn't do one for an hour. It was just do a bike ride, any distance, any speed, anything, just go for a bike ride. And usually, because there was no pressure and they felt good about themselves at having succeeded and they enjoyed it, they want to do it again. And so they go out and do it again. And, it's from a long-term standpoint in regards to exercise. If we want to maintain exercise, it needs to be something we enjoy. If it's torturous, if it's painful every time, we're not going to stick with it. So anybody who's a long-term exerciser is doing something that they enjoy. They're not doing something that's horrific for them that they dread every day. And that usually comes with a little bit of trial and error and trying things on until you kind of find your sweet spot. But as long as you can get somebody just to start something and to start feeling the effects of physical activity, which is kind of where I go next. If they've been doing that for 2 or 3 weeks, and then we can look back at maybe their journals or their logs or just kind of their life and say, how have you been feeling? How's your energy been the last few weeks? How are you sleeping? Right? What's your mood been like? And they can start to connect the dots with, doing this thing and how it's making them feel, because all of those things start to get better when a non-exerciser starts exercising.
Oh, absolutely. Yeah. Yeah, no, that's brilliant. It's so that's similar. How a lot of times people have these. This is similar to the idea that B.J. Fogg. Are you familiar with him? He's a Stanford University psychological researcher, I guess you call him. But he has the exact thing. But I'm sure it's not just his idea. Obviously, starting small and just building up, a positive feeling. Because just like we were talking about how growing up, where a lot of times we're told, oh, they're starving kids in Africa, finish your food and
right.
In playing sports, we were told, if you screw up, if you jump off sides in football or you get, you foul out of the basketball game, you've got to run laps. It's like running was the punishment,
Right.
And so most of the guys that I used to play sports with are now just blown up, and they're way overweight and that kind of stuff. And they hated exercise. They were much better athletes than me, but they hated it because of that kind of.
Yeah, makes sense.
Yeah. So I like that. Just the small habits and then just building a positive intrinsic focus. So how you're feeling. That's awesome.
Yeah. Well, and it makes us feel successful, right?
Yeah.
When we have a goal to exercise 6 days a week, which, an example would be like New Year's resolutions, right? A lot of people make New Year's resolutions of I'm going to go to the gym every day, or I'm going to go running every day, or something that, sets them up for failure, because as soon as they don't reach that, they think I failed.
Right.
My goal was to run 6 days a week, and this week I only ran 4, so now I'm a failure. But if my goal was to run 2 days a week and now I ran 4, I'm a superstar.
Yes.
Right? Because I've gone above and beyond. And it's not about, creating low expectations, but it's about creating barriers that you can run through and say, I'm going above and beyond, and now I'm going to set the bar higher. So it's kind of building baby steps, right? So that you can keep moving forward, as opposed to having to move right here and then having to drop back down.
Which is impossible for almost everybody. And unless I did have a guy who was a former, Army Ranger. He'd been out of exercise for like 12 years. And yeah, he could flip the switch. I still, with him though, I had to like counsel him to like slow down, because his mind was like already out here. And the thing is, he was still overweight. He could injure, his joints and, or blow out his knee or something like that. So I had to like tell him, hey, listen, if you blow out your ACL, and if he wanted to go back to skiing and doing the Black Diamond slopes. I'm like, let's take it easy. Let's do that maybe next year, But that's a rare case, That's a rare. But I really appreciate your approach to that. That's wonderful. Let me think about one other area here, and I guess do you find is it important to actually have to label something as an addiction? Because, a lot of times people say in common day-to-day, life, oh, I'm addicted to chocolate, or I'm addicted to ice cream, or I'm obsessed with this, or I just really like it, Does it matter? Is that important in dealing with these kind of problems, or is it not important?
Not necessarily. I would say it's very person specific. Some people need that categorization. Some people need to be able to say, I'm this, and that's why this is happening, so that, it gives them some framework to understand it and then to work from. Not everybody needs that. Some people can say, I have a pretty unhealthy relationship with food and in this area and this area, and I want to work on that. Whereas other people need the label to be able to say, this is what I am, and that's why I need to do that. So it's very personality based. And, just like in any other field of mental health, somebody who struggles with anxiety issues may need the diagnosis, may need to be able to be told, you have generalized anxiety disorder, or you have panic disorder, or you have obsessive compulsive disorder, or social anxiety disorder. They may need that label, whereas other people may be able to say, you know what, I know I have some anxiety issues I want to work on.
Right.
And so, everybody's different in terms of what they need. So from my perspective, on my side of it, I don't need the label, but I can use it for people who do.
Right.
And that's where it becomes effective.
And how are you able to sense that? Do you have like a spidey sense of?
I mean, a little bit, but it's just in the way that people talk about themselves. Okay. I mean, you identified it yourself when you said people are like, oh my God, I totally have a chocolate addiction, as opposed to somebody who says, I really like chocolate.
Yeah.
Right. And so you can just kind of get a feel for it in the language that people use and the way that they talk about themselves, what they feel they need to be able to move forward. So you just get a feel for it as you talk to somebody.
Yeah. That's awesome. That's awesome. Wow. Well, that's most of what I had on my notes here. The thing that I was just wondering is, if there's anything, are there any new areas that you are, looking at as far as whether they are areas to help people with in this area, anything that's new coming down that maybe you're excited about that people don't know too much about yet?
I mean, I'm not sure if these are new areas, but they're areas where there's always new research emerging, and particular sleep and its impact on weight. And then also mindful eating, which has been something that's been very well researched, but there's always kind of newer and cooler research coming down the pipe on that gets me excited. But sleep is one of those things that's really fascinating. And I treat insomnia now. I became a certified insomnia treatment clinician because I was working so much on sleep with my weight management population. Because sleep is so integrally tied in to so much of our hormones, and our hormones are so in charge of our weight and our eating behaviors. So, people think it's odd at first that when they come to me for weight management, I'm asking them all these questions about sleep and trying to work on improving their sleep quality, their sleep schedule, their sleep duration, their sleep environment. But it's so tied in, because when your sleep is poor, when your sleep duration is too low, all of your hormones get out of whack. And, we have these hormones that have been kind of identified. I mean, this is in the last 10 to 15 years. Leptin and ghrelin are hunger and satiety hormones, right? These hormones that tell us to eat, or these hormones that tell us to stop eating.
Right.
And if they're out of whack, if they're not where they need to be, we may be physically satiated, but yet we have this hormone saying eat, eat, eat.
Yes.
And if that's going on in our brains, it doesn't matter how we feel in our stomach. We're going to eat. And, we have this other hormone that's supposed to tell us when we're full. And if that doesn't kick in, we're going to keep eating, because we're looking for a cue physiologically to tell us we're done. So sleep is one of the most effective ways to keep those things in control. And you talked about, being pre-diabetic, and, insulin resistance is the primary precursor, right?
Oh, and, exactly. That was totally part of my problem. I mean,
and our insulin balance is also impacted by sleep.
Yes.
I mean, the better our sleep quality, the more responsive our insulin is. And again, when you look at these other hormones, leptin and ghrelin, if those things are out of whack, they also influence our insulin. So all of these things that impact our eating behaviors, our relationship with food, the way we store body fat, the way our metabolism functions, all of these things can be severely impacted by poor sleep.
Yes.
So the idea of kind of sleep is something that always gets me excited to work on with people, because it sort of feels indirect as a route to take, but it's actually a surprisingly direct route to help people in this area.
Yeah, absolutely. It was. I look back. It was a blessing in disguise for me to realize that my fasting glucose was about almost 130, and when I was tested, and because of that, I really had to go back into why and how could this happen to me? All my friends think I'm the healthiest guy they've ever seen, and blah blah blah. And it was sleep. It was too many carbs, and probably too much alcohol too. Even though, it wasn't compared to. It's all relative when you're around people who are drinking a lot, and you're only drinking 2 or 3 drinks. But 2 or 3 drinks for me every night is too much. You know?
Well, it's specific to everybody, right? And to your point, I mean, none of these things exist in a vacuum. None of these things exist independently of one another, right? Everything is tied in. When you're talking about weight, when you're talking about physical health, right? It's not just about the food you're eating and whether or not you're getting exercise or how much exercise you get, but sleep is a critical part of this. Your stress levels are a critical part of this. Your general self-care is a critical part of this. All of these lifestyle factors like alcohol, right? They're all a part of this equation, and it's a complex equation. It's not as simple as calories in, calories out.
Yeah. Well, I see with a lot of people, and myself included, that if I get into the bad cycle, not enough sleep, so what do? You compensate with more caffeine, and I love coffee, but I know my metabolism limits, and I know when to, I need to cut it off after about 3 o'clock, and to go to sleep at 11 p.m. For me, that works. But that's why I didn't want to have coffee before this exercise and feeling good. But but if I did have it, or other people, if I do have later afternoon coffee, then I feel like, oh gosh, I really want to have wine tonight, even though I wasn't planning on it. And I need to have 2 glasses of wine to compensate and lower that adrenaline and cortisol I've got from the caffeine. Mm-hmm. And so then, you fall asleep, but you don't go into your deep REM stage. So then you wake up, and once again, you're not feeling good. Yeah. Get the quality. Is that something?
Yeah. I mean, you may think I slept all night, but like you said, you've probably stayed in stage 1 and stage 2, these light levels of sleep, because, alcohol in particular, and then you add in caffeine, right? These things are blocking your ability to move into deep sleep. Mm-hmm. And they're acting almost more like a sedative, right? Or they're keeping you unconscious, but at this lower level of unconsciousness. So you're not actually getting the restorative benefits of sleep. All come from stage 3 and 4. So if you stay in stage 1 and stage 2 sleep all night, you're going to wake up and think you've slept all night, but you're going to have all of these negative impacts.
Right.
And that just creates that vicious cycle you talked about, right?
Yeah, exactly. Well, my wife and I had a surprise son that came to us 4 years ago. And that was another really hard thing at first, but then I realized, I need to really, buckle down, and because he's a light sleeper, he would wake up. Today he woke up at 5. So he's in his bed singing the alphabet. He starts singing Jingle Bells, and then he comes into our room and he says, "Papa, I want to go downstairs, and I want to draw something. Come play." And I'm like, oh my God, I went to sleep at midnight. Anyway, well, this is awesome. We've got some great material. I think people are going to be really excited to hear this interview, and I think this is probably a good time to start winding it down. I do have one question, a really simple question I like to ask most people, and that is, if you could have a billboard advertisement that you could plaster around the major cities of the world, what message would you like to leave or put up there for a month?
Oh, that's a great question. I say this all the time to people, but self-care is not selfish. Is something I tell people all the time, because people think putting time and effort into themselves is a negative, selfish act. And I think it's one of the most effective things you can do to take care of yourself and to help and possibly take care of all the people around you. When, I talk to maybe a working mom who, she has a husband, she has a child, she has a home, she has a job. All of these things come before her in terms of, taking care and meeting needs. And so she has nothing left, her metaphorical cup is empty.
Yes.
And if she were putting time and effort into taking care of herself, she would be doing a better job with all of those other things. She would have more patience with her child. She would have more attention and energy to give to her husband. She would have more focus and energy at work. All of these things get better when we take care of ourselves, when we meet our own needs, when we fill our own cups.
Absolutely.
So self-care is not selfish.
That is awesome. I love that. I think that's a wonderful point to finish this up on. And so Dr. Candace Seti, thank you so much. Hats off to you for all your great work and great ideas and great communication style. I can see you've done a lot. You do very well with these things. So keep it going.
Thank you so much. Thank you for having me. It's been great chatting with you.
Yeah. Same here. So let me just go ahead and turn off our recorder, and I'll just